I'm Dr. Jason Bowlds. I'm a general surgeon, and every week I try to bring you videos on the prevention and treatment of diseases that affect the abdomen. This week I would like to talk about a topic that we see on a weekly basis and that is becoming a more prevalent problem in the United States, called fatty liver. This is also known as non-alcoholic fatty liver disease, and in its later stages as NASH, non-alcoholic steatotic hepatitis. The prevalence of fatty liver disease, especially in the United States, is starting to get out of control. It is currently the #1 form of liver disease in the Western world. In a recent study of 400 military families in the United States, the prevalence in that group of fatty liver disease was 45%. Currently, fatty liver is the #1 cause of cirrhosis in the United States. It has now overtaken both hepatitis and alcohol as the leading cause. This is just further evidence of how the diet in the United States is wrecking our health. The risk factors for fatty liver disease include central or truncal obesity, hyperlipidemia, especially high triglycerides, and the entire spectrum of diseases that go along with diabetes, including borderline diabetes and insulin resistance. The first question is, how do we diagnose fatty liver disease? And unfortunately, fatty liver disease does not cause any symptoms such as abdominal pain. Therefore, it is usually picked up on routine liver tests or an ultrasound or CT scan that was obtained for other reasons. If on routine exam you are found to have increased liver tests, then the first test of order would be to get an ultrasound of the liver to rule out gallstones, biliary obstruction, and fatty liver disease. Usually we defer biopsy of the liver unless we are concerned for progression into cirrhosis. Usually the information of fatty liver is passed on to patients, but very little information is passed on how to treat this disease. Even when you look up studies or articles on fatty liver, they discuss how to diagnose and how to follow it, but they give very little direction on the actual treatment other than weight loss. But the actual treatment of fatty liver disease should be more specific than just generalized weight loss. Much like the diseases on the diabetic spectrum, including insulin resistance, fatty liver is caused by an increase in caloric intake and especially an increase in the consumption of carbohydrates. When your body consumes too many calories, it overloads the system and your body doesn't know what to do with the excess calories. Especially with carbohydrates, your body changes this into triglycerides, which are then stored as fat. Over time, a buildup of triglycerides in the filter causes an enlargement of the liver and a dysfunction in its filtering processes. The first line of treatment is obviously a decrease in caloric intake. The easiest way to do this is to put a calorie counter on your phone and to see if you're consuming more than 2,500 calories a day. The second step is to decrease your carbohydrate intake on a daily basis. Most people know that sugar is bad for us, but most people do not consider starch in the same way. However, your intake of bread, pasta, rice, and potatoes, when in excess, is treated by your body the same way that sugar is. So by limiting your sugar and starch intake, you can reverse this disease. Obviously, since this disease affects the way that the liver functions, you will also need to decrease your alcohol and Tylenol consumption. Also, some people have naturally increased triglyceride levels that has nothing to do with their diet. If you are someone with high triglycerides and you've attempted to manage this with diet without success, you need to talk to your family doctor about getting on medications specifically targeted to get your triglycerides down. I hope this short video has been informative for you. If so, please subscribe to our channel below, and in the comment section, please leave any topics that you would like to hear more about in the future. As always, I am Dr. Jason Bowlds, bringing you better health through better education.